Hello everyone and welcome to Meredith and I's presentation on myokinetic stretching technique for a fibrotic mass in an individual with CMT. Before we talk about the article and treatment we chose, here's a brief overview of what CMT is. It's a muscle impairment of the SCM where it's a unilateral tightness that causes a limited range of motion and impairments in ADLs. It's possible with CMT that there will be a fibrotic mass along the SCM which can increase treatment length. It's also common for there to be plagiocephaly or hip dysplasia in this population. The treatment we chose to discuss is myokinetic stretching. This technique is a form of myofascial release that's used to resolve top bands and muscles. Myokinetic stretching requires a sustained localized pressure on the fibrotic mass while applying a stretch to that muscle. This can be done with active or passive stretching and can even be done with muscle energy techniques. It has also been proven to be a safer stretching technique for infants. The overall purpose for myokinetic stretching is to improve the range of motion of the SCM, to reduce the size of the fibrotic mass, and to resolve the top band. Now we want you all just to take a moment to stop and think about how this diagnosis and treatment would affect the ICF model for these patients. So some impairments in body functions and structures would include impaired joint mobility, SCM tone and power, decreased voluntary control of the SCM, possibly plagiocephaly of the head and hip dysplasia. As for activity, there would be limitations with the infant trying to eat, using their fine hand motor skills, and just hand and arm use. As for participation, there would be some restrictions with the parents feeding the infant trying to sleep and play.
The outcomes of the myokinetic stretching technique include improving cervical spine motion, specifically in rotation and flexion, which makes sense since the SCM controls those motions, and that's where we're focusing on. Head symmetry was also improved. As you can see on the picture to the right, plagiocephaly is common in children with CMT and can cause asymmetries in the side with the tight SCM. The article that we will elaborate more on the next slide talked about how myokinetic stretching technique also provided short and long-term benefits for the patients with CMT, which is promising of this technique. One of the biggest outcomes that those who had myokinetic stretching performed was that it required less treatment duration, going from about 3.8 months needed to 1.7 months, which is cost-effective for the families. The article we found that suggests the use of myokinetic stretching for those with CMT had 32 infants with CMT. Baseline measurements were taken of the patient, such as range of motion, muscle integrity, and facial asymmetry comparison. Two factors that are needed for appropriate myokinetic stretching include ipsilateral cervical rotation with contralateral cervical flexion and myofascial release by applying sustained finger pressure for 5 to 10 seconds on the nodule in the SCM. These patients were taken to their in-range limitations where the myokinetic stretching was performed. We have the specified FIT principles used for this intervention in a following slide. The patient's parents were then educated on an HEP, which consisted of gentle stretching and massage, and education on head positioning and handling skills for their children. The result of this article include that range of motion was increased as well as was head symmetry. Muscle thickness when compared bilaterally was found to be similar in size and mass after the intervention sessions. It was found that it took a little over a month for the fibrotic mass to be completely gone using myokinetic stretching. When looking at long-term, a year after the intervention was performed, the patients presented with neck movement that was normal during age-appropriate play. Overall, myokinetic stretching did improve the patient's functional deficits. The FIT principles included in this study include meeting with the patients 5 times a week. Each session included 4 sets of 15 stretches with a 5 to 10 second sustained pressure. The intensity of these stretches were until motion was ceased with an end feel, such as muscle stretch, or there was a pain limiting factor where the therapist could not go any farther. Each stretch cycle concluded with a 3-minute rest break. This was performed for about 30 minutes each session. It is important to keep a careful eye on your patient when applying the myokinetic stretch so that no adverse reactions happen, such as reflexive contractions, local hypertonia, or noxious pain of the involved SCM. When performed correctly, the top band with the fibrotic mass in the SCM will loosen up and become more functional.
For a myokinetic stretching technique, you're going to want your patient laying supine, and you're going to want their head in a little bit of extension here. If you also have a parent with you during the session, you can ask them to hold the patient's shoulders down, just to increase a little bit more stretch of that SCM. So for this, the patient's going to have that fibrotic notch along the SCM. So what you want to do is you want to palpate the muscle, and you're just going to feel for where that notch would be. And you also want to be careful when you're palpating for the muscle not to go too anterior, because then you're going to be pressing down on their carotid. So you're going to feel for that notch, and what you want to do is you want to have apply sustained pressure on that notch, and you're going to do some stretches with them while you're applying that pressure. So you can side bend away, or you can rotate towards. So for one set of these, you're going to do 15 stretches with that 5 to 10 second hold. So I'm going to go ahead and feel for that notch here, apply that pressure, and side bend away, and hold this here for 5 to 10 seconds. And then bring her back, and you're going to do that 14 more times for one set. So typically you're going to do 4 sets of 15 with that 5 to 10 second hold, and you're going to take a 3-minute rest break between each set. And it's going to be about 30 minutes per session, and you want to do this at least 5 times a week.